Hello, everyone, colleagues, faculty. Thank you so much for joining me on my presentation today. My name is Shanada Williams, and I'm an MPH student here at St. George's University. So what I'll be talking to you about today is the opioid crisis in North America, specifically the United States. Just a little bit of background information on what are opioids. They're a class of drugs used to treat persistent or severe pain. They're sometimes called narcotics. Of course, we're used to that terminology being tossed around. They're derived from opioid poppy plants. And actually, some comes directly from the plant, while others are actually made by scientists in the lab. Common names that we're used to in the community are morphine, fentanyl, heroin, codeine, oxycodone. So let's talk about the mechanism of these types of drugs. So opioids attach to the opioid receptors like the mu, kappa, others as well. And these receptors tend to be located in the brain, spinal cord, in the gut area, and other parts of the body as well. Essentially, their role is whenever a patient takes opioid, they block the pain messages sent from the body to the brain and spinal cord. So how long has opioid been around? This is not really relevant to my talk, but I just love to throw a little bit of history in there. So opioids has been around for quite some time, since the 1800s, and we're familiar with the use of these medication to aid wounded soldiers in the battlefield. Now let's fast forward about 20, 30 years, or even to today. When were they first approved by the FDA? So an article that I read said that the first one to hit the market was OxyContin, probably around in the late 1990s. And again, they're used for treatment of chronic pain and cancer pain. And it's very important for me to point that out to you, that chronic pain and cancer pain was what they were intended for. So what went wrong? Why am I talking to you today about an opioid crisis that we're now having in America? How did this community issue come about? Well, a lot of papers that I've read so far pointed to loosen federal restrictions on prescribing. So doctors were prescribing now on a wider range, not to make light of the situation, but some doctors, I suppose, would prescribe opiates if you have a finger pain or something, and you really convince that provider that you need opiate. Also, insufficient regulation of the pharmaceutical company and healthcare industries. The embrace of profitable prescribing market, and that's a key one. The fact that you can prescribe and make some money, so it was very lucrative. But why? Some people say, well, doctors were just overprescribing at will. Well, in their defense, honestly, a lot of the doctors were prescribing because big pharma reassured the medical community that patients will not become addicted to opioid. And of course, doctors went ahead and essentially prescribe under false pretenses. And as you know, that got us in the situation we're in right now, this opioid epidemic in America. So what's the scope of my issue? Yeah. So death from overdoses or overuse has reached epidemic levels. Can't stress that enough, epidemic levels. The epidemic was officially declared in 2017 by the HHS. Non-lethal overdoses becoming burdensome. And what this means essentially is not only are people dying, but also they're, with the overdoses, the health system becomes overwhelmed and, burdensome with treating patients who are coming in for an overdose. So opioid overuse is a major issue within the United States, leading to homelessness, financial difficulties for families, and local governments around the country. Municipalities are struggling to keep up with the demands for social programs to help these patients rehabilitate themselves. There's a significant financial burden, of course, on the federal government, being that a good portion of the GDP is attributed or used for abating this opioid crisis. And of course, regulation of the methadone program, which is essentially the drug of choice today to help wean these patients off these opiates that they're taking. There are other drugs as well, like morphine, so on and so forth, but methadone is a really good one that tends to be used a lot. I just want to get to some statistics real quick. I don't want to overwhelm you too much, but according to the CDC, deaths from both natural and semi-synthetic opioids, is definitely on the rise. Prescription and non-prescribed drugs is adding to this crisis. And just to point out, opioid overdose deaths rose from over 21K in 2010 to over 47K in 2017. So that's a big jump. It's a really huge increase in deaths. Now, a significant increase in 2020 at over 68K. And then in 2021, which is what my chart is showing here, over 80K deaths. And then you might be thinking, well, the pandemic might have contributed to this. And yes, rightfully so. A lot of articles point to the fact that the lockdowns and the pandemic really helped to increase these numbers. People were depressed. People, lost their jobs, so on and so forth, and people turned to drug abuse. So, according to the CDC, they describe the epidemic in 3 waves. Wave 1, which is what my chart here is pointing out, rise in prescription opioid overdose deaths was wave 1. Wave 2, there was a rise in heroin overdose death starting in 2010. And then wave 3 is essentially the wave we're in right now, which is due to the rise in synthetic opioid overdose deaths starting in 2013. So that's one of the biggest problems that the federal government is facing right now, along with the local municipalities. So fentanyl, which is one of the major ones right now, illegally being produced and distributed all over the United States. The government has to try to control the distribution of fentanyl. A lot of papers pointed out that the fentanyl is coming in from our neighbors down to the south, Mexico, being crossed on the border and distributed within the United States. So opioid deaths is currently more attributed to the use of fentanyl in our local cities and towns. Not too much here, just wanted to talk about what the CDC points out on their website, which is 187 people die every day from an opioid overdose. That's a significant number. So if we can definitely, kind of curb this, I think it would be a great thing to do for the general population and for public health. Now, a part of this assignment wants us to talk about the risk groups or the most vulnerable in the population. So here I have a chart here from the CDC that talks about the age-adjusted drug overdose death rates by sex. And as you can see, males in 2018, the deaths were significantly, attributed to, or rather, males succumbed to death due to the overdoses. So just to continue, the highest use for opioid is among ages 25 to 34 years old. As you can see, that's quite young. And the death, of course, as I just pointed out, is higher in men. Now, let's not just only focus on men, because there is an increase in opioid use by women ages 40 to 64. So as you can see here, that the epidemic and those involved or affected by the epidemic has widened over the years. The abuse is more common in Caucasians. And again, let's not focus on race only, because we're finding an increase in Blacks, Hispanics, and non-Hispanics groups. And there are also a few incidents where children are accidentally, misuse opioids and actually have died. So it almost seems like the pandemic is, or rather the epidemic, is going the opposite direction we would like it to. Now, the meat of my presentation is what are the preventative strategies? What are the prevention strategies in 2023 to curb this crisis? So, according to the CDC, where I got most of this information, is they wanted to monitor, and they want to monitor trends to better understand and respond to the epidemic. Build state, local, and tribal capacity by equipping states with resources, improving data collection, and supporting use of evidence-based strategies. And I think that's a really great move because it shows there's a collaborative effort needed to kind of mitigate the crisis that we have on hand. Also, supporting providers, healthcare systems, and payers with data, tools, and guidance for evidence-based decision-making to improve opioid prescribing and patient safety. Just to continue on, the CDC wants to, advance research, and that's a really great place to start because if we monitor these trends, we can somewhat help. Partnering with public safety officials and community organizations, and I think this is a key one, and I really commend the CDC for this because in past history, laws involving, with the help of the law enforcement, were made, and they were said to be very punitive. And I think with this crisis in on our hands, it's better to come up with policies and laws that are not punitive, but helpful in abating this crisis. Importantly, increasing public awareness, and I think this is where the public health piece comes in, because raising public awareness about prescription and opioid use misuse and overdose to make safer choices about opioids, and I think that's really significant. We have a role, everyone I think should have a role in spreading awareness. If it's your family member, someone from church, someone from school, so on and so forth. We should be in a place to educate people on the dangers of opioid misuse. And with that's my presentation for today. I hope you learned something. Thank you so much. And this is just my citation page. Thank you.